A huge player in medical care in Colorado has a secret. It sues its patients multiple times a day after day, year after year.
Earlier this year, UCHealth told 9 News Investigates reporter Chris Vanderveen that its practices were in line with other systems in Colorado. But tonight, we can report otherwise, thanks in no small part to a change in Colorado law.
They arrive on foot, documents in hand. Personal deliveries of bad news.
Yeah, I have to submit some paperwork.
Process servers have this down. A knock on the door, a summons, a complaint, a lawsuit, and an amount.
When is the first time you find out you owe them money?
When I got served by a deputy, I got served paperwork, a summons to appear in Grand County Court.
Dan Mayer received this summons in October. It informed him the business suing him was also the business that helped save his life.
I was diagnosed with metastatic melanoma.
A little scary?
It was. I remember when they called me and they said, "We've got bad news, it's melanoma." And I said, "Is that bad?" And the dermatologist kind of said, "Yeah, it is."
UCHealth wanted $3,969.50. Odd, considering UCHealth's own web portal told him this.
When your balance says zero, you think you owe
Zero.
So you still don't really know what's going on.
No.
But they're suing you,
Yes.
and that doesn't feel good.
No. Not at all.
Ayla wanted us to use only her first name. In September, she received this summons notifying her UCHealth was suing her for $1,828.19. Also odd.
This is crazy because I just finished paying off all of the debt. I was like, what the heck is going on?
Odd, considering her online portal indicated she too owed UCHealth nothing.
I know I worked so hard to continue to pay that bill off. And then for it to come back like 3 years later, I was so appalled by it.
One ER visit for a broken bone in her back. She even went as far as to show us her bank records that showed her paying whatever she could month after month for more than a year.
Sometimes the $25 was all I had left in my bank account. And I was like, see ya.
It is the largest provider of healthcare in the state, and arguably its best known. UCHealth cares for millions a year. It also sues thousands under the idea those patients simply don't want to pay their bills.
Why continue to do this?
We do not want to end up in court. Any patient that responds to us, we will work with them.
When we spoke to their chief legal officer earlier this year, she insisted UCHealth was no outlier when it came to its litigation practices.
Our practices are pretty consistent, I believe, with most other systems in Colorado and across the country.
But now, for the first time, we can report otherwise. Thanks in no small part to this legislation signed into law earlier this year, a law sponsored by legislators who credited our coverage during its passage. Since August, no other large medical provider in the state has sued more patients than UCHealth.
We believe that UCHealth has the resources and power to stop this.
The news hardly surprises people like Marissa Halo with the Denver-based Center for Health Progress.
We do not hear from people that are being sued by other hospitals in Colorado. The folks that are coming to us consistently have been sued for care at UCHealth.
The law, which went into effect in early August, put an end to a years-long practice first uncovered by 9 News Investigates of UCHealth suing under the names of third-party debt collectors, a practice that made the medical giant's litigation practices virtually impossible to track.
I was shocked by your story. I was shocked at the volume of the cases.
State Senator Sonia Jaquez Lewis sponsored this legislation. So did State Senator Lisa Cutter.
That was a great story, and I really appreciate the reporting.
Now able to track all lawsuits, we built a database of every debt collection case filed under UCHealth's name since August 9th. More than 330 lawsuits that on a few dozen occasions resulted in wage garnishments. We also found this. On at least 2 occasions, the lawsuit secured the garnishment of wages of 2 patients who also happened to be employees of UCHealth.
It continues to surprise me that UCHealth would have the chutzpah, frankly, to sue this many patients.
Denver attorney David Seligman, who has sued UCHealth in the past for its debt collection practices, says once again we have uncovered a problem.
UCHealth, again, has a system of suing first and asking questions later, and that results in UCHealth being one of the most litigious entities in Colorado.
We reached out to dozens of those facing these lawsuits, and while we cannot say how many were patients who simply didn't want to pay their bills,
I was like, what the heck is going on?
patients like Ayla told us they had no idea they even had a bill left to pay.
I don't want to go to a UCHealth hospital after this.
Dan Mayer simply told us.
You seem like you're glad I called you.
Beyond glad you called me.
Told us he's relieved to know he's hardly the only one to get that knock on the door.
I thought I was very unique in this until, I'll be honest with you, until you talked to me, because it told me the magnitude of this.
We first reached out to UCHealth for comment on this story last Thursday, and again yesterday. The hospital has clearly chosen not to talk to us regarding the story and not to answer any of our questions. We can report that the only other hospital system that comes close to UCHealth's lawsuit numbers, Children's Hospital, which has filed more than 250 lawsuits since August. A spokesperson told us lawsuits are a matter of, quote, last resort. Chris Vanderveen, 9 News.